Good afternoon, everyone. I just want to thank Derek for inviting me here, and for the organizers as well for making this possible, and for all of you for being here. I must say I'm well impressed with Derek. I didn't even share with him that profile. He's a very resourceful guy. I don't know where he found it. And it's very complete, so thank you very much. So really, I'll just speak from the heart, just like the previous speaker. And then I guess we'll have the plenary session when we are discussing the 3 questions that I think I saw in the program. So briefly, I would just like to talk about telemedicine, digital health, healthcare. We're all healthcare practitioners here, or related professionals, meaning that ours is really to see how to help people who have health problems. We are problem solvers. And people have many problems. That's why we go to school for so long to be able to solve those problems. You've had practically my whole biography there in a nutshell. But when I ended up in, after internship, ended up in Thika District Hospital as a consultant physician, I found very, very interesting things. Before that, I must say that I had been questioning things. I had been questioning things for very long. Why do we do things the way we do? Could things not be done better? So when I got my scholarship to go to Spain to do medicine, I was there for the required time and came back only to find that a close relative of mine was very sick. He had been diagnosed with diabetes, actually like 8 years before. And he had been diagnosed actually at an insurance checkup. This is a relative who used to live somewhere. Anyway, he had managed to get an insurance cover. He had gone for his insurance checkup. He had been diagnosed with diabetes. He was put on Downing, very low dose. And being very conscientious, he took that medicine every single day. But unfortunately, the dose he was taking was too low. So what happens? The sugars remain high, isn't it? So over all those years, because he never went back for a checkup, he didn't know he had to go back. No one told him that he had to go back. He was very annoyed about it. Why didn't someone tell him? So he didn't know. He kept taking his medicines. When I came back, I was going around seeing relatives, the new doctor in town, measuring everyone's blood pressure, blood sugar. So I got to him, and my goodness, I couldn't believe it. The sugars were up, the pressures were even higher. And in very few days, I organized for him to be taken over to one of the physicians. And you know what? They discovered he had renal failure. I was like, man, his favorite relative of mine, he was one of those old guys who are really good when they're growing up. Eh? And so that was a major point of question. Here's this guy, he has insurance, he's been taking his medicines, and yet here we are as if none of that happened, as if there was no health care. He still has his renal failure. I asked myself, what could have been done differently? What could the doctor have done? I kept blaming the doctor. What could he have done? Could he not have called this patient? Could he not have found a way to get him to come for a consultation? Was there no way for him to know what his sugars were? So it got me thinking. So fast forward to Thika. I'm the physician now, gone through MN, finished, and there I am posted. This is, should I say when? Maybe not. So there I am posted in Thika. And you know what? I saw the same thing. I saw people coming. They're seen the first time at MOPC. Then they're sent to work by their employers to Mombasa, Kisumu, Nakuru, all over the place. So obviously when they're there, they don't even know where to go, because now my file is where? It's Thika. So they can't go anywhere else. So when they come back after a year or 6 months or whatever it is, we check their blood pressures, blood sugars, same thing, all over. Medicines, they don't even remember which ones. So we kept starting all over again, all over again. Now let's start with these, because you don't just go back to the old ones. You probably have higher doses of all of them. And it was one thing after the other until like the second or third visit. And from there you do the UVCs, same trajectory, dialysis. And I was like, no way. And it was one case, another case. And these are not old people. These are guys in their 30s, 40s. Those are young people, aren't they? So I kept thinking, is this where we're headed? Can our health system not do more? So that got me asking myself, look, and by the way, M-Pesa just came up. That was 2007. Because I remember in 2005, my mind was just, and sometimes our patients would come. This is how the beauty of the human mind, when you're out to solve a problem. I'm sure you've noticed it with you guys. When you're out to solve a problem, your mind is in another mode. So patients would come to me. They come out and tell me people are pressure for a pharmacy and nothing. So they come with their little pieces of paper and they place them on my table. So in my mind, I'm thinking, gosh, why am I struggling? Can all this not be on an online system? So I see all this online, on a graph. So I was just seeing solutions. Or sometimes patients will come and they say, "Daktari, nilikuja kwa hii pharmacy, nikapatiwa hii na hii dawa, nikaenda kwingine, nikapatiwa hii ingine, sasa hizi zote zimekosa kufanya. Ndio maana nimekuja." So I'm thinking, hey, wait a minute. If everyone is going to the pharmacy first, before the doctor, why don't we meet at the pharmacy? Let's meet at the pharmacy. Let's have pharmacy-based telemedicine, right? So that's how I developed some of those models. So obviously with all these things, I called one of my IT guys, one of your colleagues, and I told them, look guys, this is what I want. And they came up with it. They came up with the very first version of Daktari Africa. That was 2008. It was now 15 years. And I was just telling them, I want to be able to do this. I want to be able to talk to patients. I want to be able to see their blood pressures, their blood sugars. I want to be able to do X, Y, Z. I want to be able to have education sessions. I want a social platform for doctors to interact. I want all that. Just do it. And I knew very clearly what I wanted to see. So, I remember the first guy who I sat down with, actually I was very lucky. I got a good guy. And he captured everything and put it out there. And he used a very simple platform at that time. It was called Joomla for the pharmacist and tech, the Pit Africa people. So that's what he used. And it worked well at that time. We actually won our first award with that first iteration of Daktari Africa. It had a different name. It was called Find a Doctor at that time because of that whole process of patients getting lost in other towns. So even while they're there, how can they find a doctor in that town? So it was like, if you want to imagine the structure, it was like a LinkedIn for doctors at that time. LinkedIn didn't exist. Actually, I didn't know of any other telemedicine platform at all. It just was from my mind. And but the structure was very similar. So wherever the patients were, who are the doctors there? Can they speak their language? Can they take this insurance, etc., etc.? So, but with time, with that first iteration, we won the 2012 Vision 2030 award, and then I realized, whoa, this is actually bigger than I thought. So I decided, okay, let's upgrade this. So 2014 took 2 years to actually upgrade. It took 1 year to find the right people, 1 year to find the right IT team to make what I want. But I kept getting guys coming in, saying, now we can do this. We've done this for Citizen. We also did this for that. So we'd sit down, and I realized, no way. And then other guys, I would approach them and they say, yeah, well, let's try. And they say, no, we can't do it. What you want is too big for us. We just want a PhD, and we just can make a PhD, whatever, but not to that level. I say, fine, thanks for letting me know. Then others went with my money, paid deposit, and they all they want to be found. So it was a whole 1 year to find the right people. And then finally, when I did find them, it took 1 year to make. We used to sit every Monday Monday morning, right? From 8 to 10. You go through what they've done, what I want to see, oh, this doesn't work, this is, oh, you've done this, fantastic. So I was very lucky at that game. I found someone who would capture what I wanted, and then he would go beyond what I asked him to do. So you watch me looking at it, and I think my eyes would just open wide and he would just smile and know what he's done. Eh? And that's why when you find the right people, you find people who understand what you want to be done, the problem that you have, it's such a pleasure. You know? It's such a pleasure to find people like that. And similarly, even in healthcare, in pharmacy, and in other areas, when you find people who, you know, or when you understand what the patient really needs, and you approach the patient from that point of view, then you get real satisfaction on the patient side and on your side. Right? And this happens also in tech. Sometimes in tech, and I think Dr. Kamotho mentioned that in a way, sometimes in tech we tend to create things and then push them to patients, right? But it really makes a difference even for sustainability to understand what's the real problem, what's the job to be done, what's the job to be done. There's a professor from Harvard Business School called Professor Clayton Christensen who used to talk about that. You know? So the last time I mentioned that, my daughter was around and she said, "Dad, how do we even know that existed?" No? And I told her, yeah, you can Google it, you'll see. Anyway, so the job to be done. What's the job to be done for our clients? When a client walks into your pharmacy or consultancy, what is he or she actually looking for? What's the problem they're solving? It's very easy to say, take this and go and it will sort you and the society out. But what's the real problem? And it's very important to understand that. And that's what we've tried to do at Daktari Africa, to understand what's the problem of individuals at home. What health problems are they going through? What's the problem of individuals out in the community? What's happening to people who work in companies? And then we mold ourselves. We're very, very flexible. So we like, for instance, the model of pharmacy-based telemedicine, which applies to all of you, that was just molded and created, and it worked. Actually, we signed an agreement with one of the pharmacy chains, and it worked so well. We started a pilot of 2 branches, then we moved to 8 branches, and then the board agreed that we take up all the branches. There were 80 at that time. But unfortunately, then the company was bought out, and the new board that came in had a different way of doing things. So we didn't continue with that, but the model is there. And we learned a lot on how to change things and how to do things. By the way, is this camera working? Because I've just realized that I've been walking in and out of the field. Just now I thought to follow me, so I looked and it wasn't. So anyway, so that's how we hold ourselves. So that pharmacy-based model, and another one which was to do with the youth, counseling for the youth in schools, won us a National Innovation Award in 2016. So it's been a very interesting journey with recognitions that have made us know that we are on the right track and that we are onto something. And this has led to invitations, even to speak at so many different fora. I've been invited by the Kenya Association of Physicians. I've been invited at the Kenya Cardiac Society Conference. I've been invited to Geneva, to the World Heart Summit, to talk there. I've been invited to Bahrain. So many amazing places. But let me tell you something. All those invitations are good, but the real satisfaction comes from what we see in patients. I was just looking at some statistics of a questionnaire that I gave out this morning. I was invited as the CEO of Daktari Africa to one of our corporate clients to give a health talk. So we're looking after that corporate client. And the topic of today, one of those ones which talks about. It's also an S word. Dr. Bosira talked about sex today, isn't it? Normally, you don't even say that word so loudly. The one of this morning was even one of those. It was suicide. And I was asked to talk about suicide because of the International Men's Day. Right? International Men's Day. And we know that suicide is real, it's happening. It tends to happen in different age groups, different places. But I give out a questionnaire. And guess what? We've already found from the results that we have 2 people who are already thinking of doing crazy things. Right? Doing crazy things. So when I think of such cases, when I think of the people who we're touching, the people who we're helping, when you see that patient who was about to get into kidney failure and now he's better, when you think of solutions you've given out, it's really, really satisfying. To me, that's more than money and more than anything else, right? There's a lot of fulfillment, but that's why we went to school anyway. And we're all here, we understand what that means. So, so at Daktari Africa, ours is very patient-centered. So we are indeed the first patient-centered telemedicine platform in the country and the region. And one time I was in an interview and I mentioned that, and the professor, he's a professor at Kenyatta Hospital, he asked me, Doctor, wait a minute, what do you mean the first telemedicine platform? And he went on to remind me that actually he himself had come up with the first model, but that was doctor-to-doctor consultation. So I specified that ours is doctor to patient. So we make it very easy, super easy for patients to be able to talk to doctors and even specialists like myself and others. So if you look at our platform, we have over 600 doctors who have signed up for telemedicine. And what we do is we create opportunities for patients, we create opportunities for healthcare workers to be even liaison agents. So this is an opportunity I see also for the pharmacists. Again, I'm thinking of the pharmacy-based model. I'm seeing many of you perhaps being in positions where you either are opening a pharmacy or you're in charge of pharmacies, and you're able to create opportunities for patients to see doctors while they're at the pharmacy, because that's the model that we developed. So a patient would be able to go to the pharmacy, and instead of just dishing out prescription drugs, or instead of having to diagnose, we know that we can do that, many pharmacists do, but now we're able to be more compliant with the Pharmacy Invoices Code, and we can get those patients to be seen by a doctor while they're at the pharmacy. They get their prescription and you dispense the medicines right there and then. So that's how that one works. So there are many things I could talk about. Maybe I'll just perhaps conclude with some of the research that we've done. We've managed to do what is called now community-based telemedicine, whereby we were able to show that telemedicine, well implemented in a community hospital, can actually help to control blood pressure in hypertensives. So this is a study we did in 2019, the whole of 2019. We got a grant from one of the big pharma companies, and were able to carry out that research, that study, that work over the whole year. And as a result of that, we were able to publish the results at the European Society of Cardiology Congress in 2020 in Amsterdam, and later to publish in the European Heart Journal. Then guess what? That article was cited in none other than The Lancet. So we're very happy and glad to see that. It was cited by the World Heart Federation. So for us, research is big because that shows scientific vigor. It's not just a commercial thing, it's real science. And we value that a lot because that is what will help our clients eventually. We also are very big, as much as we look at telemedicine as this new thing and amazing thing, we realize it's just one more tool. So it should not replace physical consultations. So in the models that we have for community, for corporates, for this and the other, there's always a certain element of physical consultations. Right? So because that is what helps to build trust. And trust takes time. And let me just mention this because you will also identify with it. Be careful with investors. Be very careful with investors. Careful in the sense that many investors will want their money back quickly. You may not have made it back on time. You've heard of this pharmacy chain, Machogu and the rest, right? So he can tell you about investors. Actually, if you ask him about that, you'll see the immediate reaction. And it's like an allergic reaction. But the good thing is that he learned very many lessons and he shares them freely. So be careful with investors. You can work with grants and the rest. That's fantastic. That's great. That pushes you very far. But and why is this? Because when healthcare is done well, then you need to build that trust with people, with clients. Healthcare is not exactly an FMCG, a fast-moving commodity good. So you have to be very judicious when dealing with them. But yes, so I could go on and on, but I think we'll be having a workshop after this where we'll go deeper into some of the questions, the health challenges. This is the way I want to structure our workshop. After lunch, we'll go through some of the health challenges that are there and how we can solve them. I want to see how innovative you are. I want to see the most innovative people here, so that when I decide to invest now, I invest in that one or two people. So anyway, so that will be the idea of that workshop, and you're all welcome. So thank you, Derek.
Thank you so much, Dr. Charles. Okay, you look dull, you're not excited. Amani, Friday. So I'm going to rejog your memory to some activity we did on Wednesday, when we began the summit. So we all remember the old Sunday school song, Fishers of Men. So we're going to do that, Changamke, before our final presenter comes. So I'm going to request us